Thank you, Greg, for the mask. And thanks to Jay and Vicki, as always, for interpreting for us this morning. So a couple words or phrases were used by the governor yesterday in his news conference. Shocking, a red tide across Ohio, and record hospitalizations are phrases that the governor is using to describe what's happening in Ohio related to COVID-19. And the numbers in Hamilton County continue to rise. So I'll walk through the numbers, and then of course Greg will elaborate. So we have seen 16,234 positive cases of COVID-19 in Hamilton County. The increase from last week is 1,327. Hospitalizations stand at 1,246. The increase from last week is 41. And the death count in Hamilton County is up to 338. The increase from last week is 1. And so what we are seeing is an exponential increase in positive cases of COVID-19 in Hamilton County. And I know I've done this in the past, and I think Scott Warman especially pays some attention to this, but I track the week over week increases in cases. So 4 weeks ago it was 490. The next week is 613. Last week it was 954, and this week it's 1,327. So you can see how the rise is exponential. Hospitalizations are starting to catch up, and those are also on the rise. And the death count, as you know, is a lagging indicator. And so the expectation is that, unfortunately, that will rise as well. The number of positive cases and regional hospitalizations are higher than they have ever been for Hamilton County. And ominously, as social activities start to move indoors because of the weather, the worst may be yet to come. But this rise is not inevitable. We have control over this. We have tamped down this curve in the past. We just need to do it again and rededicate ourselves to doing what we know works. Wearing the mask, washing your hands, and creating social distance between one another where we're in close proximity. And speaking of social distancing, some additional sacrifices will likely be necessary. Informal gatherings of friends and families are responsible for much of the current spike in the spread, as has been noted in previous weeks, as opposed to formal events that are oftentimes not happening. So we need to limit friend and family get-togethers to prevent situations where the virus can rapidly spread and reach those most at risk of complications and death. And if gatherings are happening, small gatherings, wear your mask. I want to just note one other thing, and Greg's going to show this interesting graphic about where the numbers are, right, where the cases are. And I know Greg will illuminate on this, and I don't want to steal your thunder, but it's a really interesting graphic to kind of bring this home and help us better understand how the virus is spreading and where we're seeing it the most. But one other thing related to the governor. So as you all know, he's got a map, and different counties light up when the positive cases increase in a variety of counties. And many counties right now are in the red. That's bad news, right? We're all moving up in positive cases, whether it's a rural county, urban county. We're all in this very bad trajectory. No county in Ohio yet has been purple. Purple is the most extreme. Red precedes purple on the governor's map. No county's been purple. Some of us have had stars, which are an indicator that we're moving into the purple range, but that has not yet happened. There's some concern, frankly, in some of our counties that we are going to hit purple. And so what does that mean? Well, it doesn't mean anything until it does. It's the governor's map. The governor will determine what purple means if any county gets there. And remember, the governor is starting to talk about closing down schools. We have seen closing down businesses in the past. And so the only way to prevent this county from going into that purple range as we see cases increasing exponentially is to do what we know works. Wear the mask, wash your hands, and socially distance. We know what to do. We just need to all commit to doing it. So today, we've got Greg Kesterman here. He is the Health Commissioner for Hamilton County. As always, Greg will go through some charts and numbers and trends. We also have Dr. Richard Lofgren with us. He's the President and CEO of UC Health. He is really a rock star in this community and a liaison in this community between ourselves and the work at the state level. And so he is kind of the guy in the room doing the work and representing Hamilton County in those rooms. And so he's going to talk about hospitalizations. He's also going to talk about the collaborative effort amongst the hospital systems to address what might be coming. And so I think it'll be very informative, and I'm very grateful that Dr. Lofgren is with us this morning. But before we get to that, Greg is going to walk us through the numbers.
Thank you, Commissioner. So over the last 7 days, we have seen increases in hospitalizations as well as cases here in Hamilton County. I really want to impress upon everyone the need to not let our guard down. Right now, it's super important that we think about our plans and we adjust them, because safety is number one. And if we want to continue to make an impact here in Hamilton County, now is the time to do so. Remember, if you have symptoms of COVID-19 and you need to get tested, there are so many opportunities out there in our community to get tested. There's the Test and Protect program funded by Hamilton County. All of the locations, including a link to the Test and Protect program, is available excuse me, on hcph.org. Please visit our website for additional testing locations. When you get tested, if you are symptomatic or have been around someone that has COVID-19, we are asking you to please stay home until you get those test results. The very last thing we want is for you to spread COVID-19 in the community. Looking at Hamilton County's cases, Commissioner Driehaus just referenced we are at the highest numbers yet for COVID-19 cases here in Hamilton County. My team had one of their busiest weekends this past weekend with 175 cases on Friday alone. That means we had to contact 175 individuals and their close contacts. So that work is happening. We have appropriately staffed our teams to make sure we're able to do so effectively. But it's super important that we start to get some of these cases under control. As we know, these cases are linked to hospitalizations, and we will continue to see hospitalizations increase as a result of the case numbers that we're seeing here. And I'll show that graphic in just a moment. Very closely tied to cases is our reproductive value. Our reproductive value has been above 1 now for about 3.5 weeks. Anything above 1 means that we are seeing continued spread in our community. So it's super important, once again, those very basic steps: wear your mask, social distance, keep sick at home, hand hygiene. Those are the things that we need to do if we want to get COVID-19 back in control in our community. Today's reproductive number is 1.16 for Hamilton County and 1.14 for the region. Hospitalizations, as mentioned, for Hamilton County are on the rise, although not as drastically as the region. The top graph represents Hamilton County. You can see a slight upward curve. We would continue to expect to see more hospitalizations just based on the cases as mentioned. When you look at our region, we are over 200 patients hospitalized for COVID-19. As Commissioner Driehaus referenced, this is the highest number of hospitalizations that we have seen throughout the pandemic associated with COVID. So a very alarming statistic. Regionally, we are also starting to see some increases in intensive care unit admissions, although not as drastic. Once again, it's a delayed indicator, and we are yet to see any types of increases with the deaths in our community. I'm often asked, where do people get their COVID? This is a difficult question to answer. We know that in our community, it's community spread. We know that it could be any location that you're going, and we know that it's easiest if you're not protecting yourself. Someone can also acquire COVID-19 anytime during the previous 14 days before becoming symptomatic or before having their test done. That actually is why we have a 14-day quarantine period. That 14 days allows us to find out if you're going to get sick from COVID-19. So if you're out and about, it's super important to make sure that you're careful all the time. Often people want to pick a time and spot where they think they got COVID. For example, if I went to a party last week and there were 20 people and that party was indoors, and a week later I get sick with COVID, I might want to point to that party as being the source of COVID, and it certainly could have been. But it also might have been an asymptomatic child or an adult that I was nearby and not properly masking. So there are lots of opportunities for COVID to come into our lives. The more activities that you participate in, the greater risk that you will become ill. So with that in mind, our team asked the question of our of our positive cases of COVID-19. We had about 3,000 people answer the question, have you attended a large gathering? Of the 1,660, or 53%, that said they had attended a large gathering, these were the types of activities that they attended. They attended work, many people, retail shopping, eating out, parties with friends, vacation travel, sporting events, bars and nightclubs, attending weddings, going to religious ceremonies, amusement parks, and protests were all listed. You can participate in these activities safely, many of these activities safely. It just takes a lot more work and effort on your part. As mentioned, this data does not suggest that individuals got sick from these locations. These are just locations that they attended within 14 days of their infection, and increase the number of opportunities for someone to get sick. As we have accepted new risks and invite normalcy back into our lives, we have opened up for opportunities to spread COVID-19. We can do many activities safely, although it does take more effort. We should not forget social distancing, masks, and hygiene. Packed sidelines at sporting events, large group gatherings, even small group gatherings are all opportunities for us to spread COVID-19. My message is the same, it's simple. It's already worked here in Hamilton County. Continue to keep sick at home, social distance, wash your hands, and please continue to wear your masks. We are at a critical moment, and if we work hard, we can control COVID within our community. Thank you.
Thanks, Greg. All right, we are now going to turn to Dr. Lofgren. Thank you for being here.
Thank you, Commissioner Driehaus. It's always a pleasure to be here, and I appreciate having the opportunity. As was just discussed, we have in fact seen a fairly dramatic increase in the number of cases. In fact, the number of cases in the region is doubling every 10 to 14 days in a rate that we actually haven't seen before. And this isn't just a matter of testing more or finding asymptomatics. These are translating into more hospitalizations. And in fact, we've seen an increase in our region as depicted by the graph that Health Commissioner Kesterman showed, is that we've seen an increase in hospitalizations in the region from about 90 to 200 since the beginning part of October. We are have the greatest number of people hospitalized for COVID-19 than any other point in the time of this pandemic, obviously, which is a real concern. I think the other thing that was also shown is that the hospitalization or the cases are much more diffuse in our community. It's no longer in just the high density areas of the urban core, but we're seeing it throughout the entire region, which really suggests, as the data was indicated, that this really is more diffuse community spread and really suggestive that people are starting to let their guard down on those measures that we know will make a difference in terms of slowing this virus in this community. One of the things I do want to let you know is that despite this uptick, I wanted to be assured that the health systems continue to be very much prepared. Since the virus was first introduced into our community, the health systems came together in a way that is really unprecedented, in a wonderful way of collaborating, recognizing that we needed to come together to make sure that we had all the resources available to treat or manage any of the manifestations or complications of this pandemic. We really learned how we work together in terms of all the elements of the healthcare delivery systems, not only the hospitals and health systems, but also nursing homes and the public health people. Since the inception of the introduction of this virus, this group has continued to work together collaboratively, sharing information, learning from one another, understanding what's happening in our community. We meet at least twice a week There are more than 300 people working at different elements and different groups to make sure that we are prepared to address the needs of our community on a regular basis. Through the Health Collaborative, really continued this work along the way. As we see this increase of hospitalization, it makes us recognize that we need to continue to be prepared for a possible surge. Like the first time, we have first-rate disaster preparedness in this community so that we were prepared. But I will tell you is that as the virus was introduced in the latter part of March, early part of April, we've learned a lot during that time period and are prepared. One of the things that's really quite different than what was happening in March and April is we actually now do have what appears to be an adequate amount of PPE and other equipment and supplies. We have trackers both at the county level as well as the state level, making sure that these resources are available as we move forward. I think that the other thing that thanks to Commissioner Driehaus and others, it was mentioned before, the other difference is that we have dramatically increased our ability to test and understand what's going on in our community. Again, when the virus was first introduced, we didn't have adequate testing. We really were sort of flying blind without the instruments, and we have a lot more knowledge about what's necessary to move forward. In addition, we created detailed plans about what we need to do is in a progressive way, in fact, if the demand for hospitalizations were to occur. And those plans are still in place, and we're working very diligently to make sure they're updated and should the need that we really need to accommodate more patients as a result of this uptick in COVID. We believe that the vast majority of that, if not all that, can be accommodated with the existing health systems. But again, I think we have detailed plans. One of the other things that I just want to reiterate is, and the really key message, is that we've learned a lot. We know how to slow this virus in its spread. It's not complicated. It requires behavioral changes and commitment through the entire community. Social distancing, washing your hands, and making sure that you wear a mask really will prevent this and slow the spread of this virus. I think the only other thing I'd like to mention and ask of the community is how important the work that Health Commissioner Kesterman and his team is doing in terms of contact tracing. It's a key element about suppressing and keeping this virus under control. So it's important that when the health department's called, that people answer and really are cooperative so that we can contain this virus moving forward. So with that, I appreciate having the time, and I'd be happy to take any questions as well. Thank you.
Thank you, Dr. Lofgren. All right, we're ready for questions, Alex.
First question is from John London from News 5.
Hey, John.
Hi, Denise. So I don't know if you or Dr. Lofgren want to answer this, but I wonder if any of you think at all that the reminders at this point about masking and distancing are getting rather futile, and to ask people to limit small gatherings are getting futile. The message has been out there for months. Based on what the governor said yesterday, it seems like we could be headed for some sort of action at the state level, although he has said he's not going to do that. And I wonder do you feel we need a more forceful government action to really get people's attention, I guess is what I'm asking at this point, because the numbers suggest that the message about masking and distancing suggests to some is not working.
Thank you for the question, John. So I think that the messaging about wearing a mask, washing your hands, and safe distancing are having an impact on certain members of this community. And people need to understand what we can all do to reduce the spread and reduce the infection, especially for the most vulnerable people in this community. However, there are people that are not responding to that message, or maybe hearing a different message from somewhere else and responding to that. And so to answer the question related to the governor and to the map, I worry personally that if we were to find Hamilton County inching up towards purple, we've got a map that distinguishes county to county. And I do ask myself the question, why was that done? And what does that mean? If we become purple, will it trigger something where businesses close and schools close? I don't know the answer to that because I'm not the governor of Ohio, but I do worry about it because purple doesn't mean anything until it does. And the governor is the one that will decide whether or not it does. But you heard him talking about schools closing, and even in our community, there are school districts that refer to that map when they decide whether or not the kids are going to be in person or virtual. Not all of them, but some of them. We just saw that with CPS a couple of weeks ago. And so it is really important that people in this community understand their behaviors, and this increase in positive cases is going to have an impact potentially on schools shutting down, on their kids having to stay home again, and on businesses shutting down, and nobody wants that. And so that's the messaging that I'm trying to convey. Look, we're trying to keep masked up for ourselves and others. Really, we're doing it for others, right? Those that are most vulnerable. If that is not compelling enough, there are other sticks that we think might come down relative to businesses and schools. So I don't know definitively what that might look like as these cases increase, because only the governor can really answer that question. Thanks for the question. Is there another question, Alex?
Our next question is from Chris Wederick of the Business Courier, and this one is for Greg or Denise or Dr. Lofgren.
Well, there it is. All right. I'll kick it over to somebody else.
Yeah, Denise, I'm not trying to kick you off the mic, but I think this one's for Greg.
Delighted to be kicked off the mic.
Okay. Hi, good morning, Greg. So I get the same types of responses sometimes when I write about this. Oh, well, cases are up, but that means we're testing more. And I think you'd acknowledge at least some of that. But on the hospitalization side, when I look at the Hamilton County data, and I understand there's a lag in finalization of that, it looks like the hospitalizations are pretty steady. Would you say that most of these regional hospitalizations are coming from outside of Hamilton County?
This current snapshot, based on the individuals that my team has control over, the folks that we're looking at, the positive cases, we are just now starting to see some increase in hospitalizations for our residents. So the statement that the regional hospitalizations are coming from all of the counties surrounding us is accurate, but hospitalizations, they don't lie. You are correct in saying that the number of tests performed will show an increase in cases if we're testing more. That's accurate. But what's not able to be hidden is somebody who ends up in the hospital because of COVID. That's a true reflection of how much COVID there is in our community. And as I've already said, I've not yet once seen an increase in COVID-19 in our community's hospital rooms like I have this past week. It just shot straight up, and it's very concerning.
Okay. And then you had a chart earlier about kind of where people had been when they, when they got COVID, not necessarily tracing it directly to those sources. We keep hearing from the city, and particularly the mayor and the restaurant owners, that there's no evidence that COVID is spread at restaurants. What would you say about that? Is that true?
So the way I look at it, and reflecting actually back to the data, we know that 7% of individuals that went to what they're considering a large gathering went to a restaurant. That doesn't mean they got sick at the restaurant. I could go eat out with my wife at a restaurant and be very safe and sit in a table that's correctly spaced and have servers that are following all of the correct COVID requirements for restaurants and bars. Or I could go out with 9 of my closest friends that I haven't seen in a long time, not worrying about masking and actually not worrying if the restaurant isn't following COVID safe requirements. In those two scenarios, you see different risks. And I think that holds true across the board. If our businesses and our restaurants are doing a good job in following the state guidelines that are put in place to help us keep safe, then they can do so safely. But we as individuals also have to take on some of that responsibility. And I would encourage those that go to a restaurant or a bar or any business and you're not happy with how that business is complying with state orders, please leave. We actually get web complaints. We see about 15 complaints a day, maybe a little bit less right now, probably closer to 13 complaints per day. And last night I read a web complaint that came in. A customer went into a pizza restaurant. Not a single employee was wearing a mask, and the customer left the pizza restaurant without pizza. This mentality of making our businesses accountable to the state's orders is how we will make change and how we will continue to improve our community's COVID-19.
Thank you, Greg. And then I have a couple for Dr. Lofgren, if I could, please.
Related to
Sure.
restaurants. So I don't want to have a confusing message here. So there are restaurants that are operating safely right now, and people that are going to dine at restaurants that are masking with individuals in their bubbles, and that's the way we respond to this, right? It's a change in behavior that allows us to be safe and those around us to remain safe. So I don't want to be confused here. I was just out at a restaurant in Columbia Township last week, and I actually took a tour because they've used some of the CARES Act dollars to help those restaurants establish outside dining. And so they've got new tables, they've got some fencing, they've got some heaters. That's a response to what we know we need to do. So that's good behavior. The behavior that's troubling is when people like Greg described are in these large groups with no masks on. So I do want to distinguish between a restaurant that's doing everything they need to do to stay open and a restaurant and individuals that are not doing what they need to do to stay open.
Okay. Morning, Doctor. I just wanted to see if you had any update on elective surgeries, whether you're still looking at suspending those maybe at some point, or whether that was really ever really an option given the current surge. And is there any discussion about looking at the Duke Energy Center? Are we to that point where the Duke would be looked at as an overflow site?
Great questions, thank you. You know, at this point in time, there's no interest or thoughts about needing to delay elective surgery. In fact, I think the term got to be misguided because not much care is actually, quote, elective. And we've learned a lot that when we delayed the care and the non-COVID care, there were some healthcare consequences of that as well. So as we think about the planning and preparing for the community and what we need to do to make sure that we have the resources to take care of any uptick in terms of COVID cases, we also need to make sure that we continue to be able to provide non-COVID care. It turns out to be quite essential. I think the other thing that was maybe lost is that originally we decreased the number of elective cases, not because of capacity or risk. We did it because we didn't actually have adequate amount of PPE. And we wanted to make sure we were doing everything that we would to protect our workers in terms of treating COVID patients. We're in a much better position now in terms of PPE and understanding our supply and making sure that we have adequate amount of PPE. So the need to actually reduce elective surgeries like we needed to do in the spring, I think has been reduced, if not eliminated. You know, we have, each one of the healthcare systems has plans in terms of how they can actually accommodate more patients and what they call internal surge capacity, how they can actually create beds and more ICU capacity within their facilities, within their four walls, which we think is actually the best way to take care of patients and get the best outcomes. On the other hand, if we need to think about an alternative care site, we are prepared. We've put together detailed plans when the virus was first introduced in March and April. Those plans are still in place. They can be activated in a relatively short period of time. However, I think that's way down the line in terms of what we can do in terms of accommodating any increase in cases that we might see as well.
Thank you very much. Appreciate it.
Next question is from Ann Saker from the Enquirer, and it is for Greg.
Thank you very much. Hello, Commissioner Kestman. Just two things here. First of all, there was a story in the New York Times or the Washington Post, I can't remember, within the last week that suggested that the Sturgis motorcycle rally in South Dakota really did turn into the super spreader event that had been predicted, and that it was spreading through the Dakotas and was starting to slide down into the Midwest, and that event may indeed be at least one of the embers that is fueling this accelerated rate. Any thoughts about that in Hamilton County, whether that's been touching base here. And second question is, so that's asking you to look backward. Next question is asking you to look forward. I know that no one wants to scare folks, but at the same time, we're moving into a time of year when people automatically have gatherings. And so to tell them not to have gatherings, as you have through Memorial Day and the 4th of July and Labor Day, how do you reinforce that message once again, besides just repeating it? Is there another way to get through to folks? And that's what I have to ask.
So starting with Sturgis, I have not heard from my contact tracers any information regarding this gathering, but certainly anytime folks travel to a spot where there is COVID-19 and then they return home, there is that opportunity to see increased spread and exposure. So any types of events like that, Ohio has a policy in place for certain states where we're asking folks to self-quarantine when they come home from locations with higher incidence of COVID-19. And I would hope that folks that know they've taken riskier behavior follow that same model. I actually have some team members at our work that attended a wedding, and what they did was they worked from home for the next 14 days. They felt it was important to go to the wedding and support a family member, but they realized because of their actions and their attendance at that wedding, they did increase their own risk for getting sick. And so they took those extra steps to care for those around them and their coworkers. So I would encourage everyone to consider that as an option. You are correct. We are heading into a difficult time of year with regards to gatherings. Thanksgiving's just ahead and many other holidays follow shortly thereafter. And no differently than the messaging that we've been sharing since February, we are discouraging those types of gatherings. And that's not an easy message. And during the summer months when things looked pretty good, many people, I think, kind of started to let their guard down. And I understand we are all tired of COVID-19. But as we're starting to move back into this indoor environment, I can tell you that if you're bringing people together inside, not wearing masks, we will continue to see cases of COVID-19. And when we start getting that COVID-19, particularly into our older community, we know that there will be an impact, which can include hospitalizations, intensive care unit admissions, and ultimately some folks will pass away.
I have one quick question more for Dr. Lofgren, if I might. Dr. Lofgren, on that call last week with Dr. Margolis, when he was talking about his concerns that there might be an end to elective procedures if the case rate doubled again, you didn't exactly shoot that down. You did say all the things that you said today, but you didn't say, well, we're not there yet. We're not concerned. I just didn't hear you, and perhaps I missed it, but I didn't hear you kind of step on that. So are you feeling, was that just his opinion? What are your thoughts about that?
I think that Dr. Margolis obviously was sounding the alarm appropriately and always talks about the sort of worst case scenario and the fact that, I don't think necessarily took the time to map out how far down the line that would be before we would eliminate elective surgeries. It was just, it wasn't the opportune time to say, well, listen, we have a plan very clearly about how we can accommodate increased cases of COVID in our community. We developed it. We always had great disaster preparedness plans to begin with, and we really perfected it in some respects in planning in April. We really learned on how we can increase our capacity of all the health systems. And the other thing that we've done is, at that time, was also in the collaborative way, realized that we put together a triage system, a command center, if you will, so that we can load balance the patients. If there's some excess capacity in one hospital, rather than a competitive nature, we will move patients if necessary. So that's all part of the plan and how we can accommodate any kind of uptick along the way. I think the other thing that really came through loud and clear, though, is that with the delay of non-COVID care, there was adverse health consequences about that. This idea that there's a lot of elective care is really pretty minimal. Most of the care that people get can be delayed for a short period of time, but really is essential. And we saw and have seen some adverse outcomes of that, and you probably read about that as well. So I think we take that into the calculus of how we're going to accommodate the overall health needs of our community. but I really want to make sure that people understand that there are plans in place and it cascades. And at the end of that, quite honestly, we would go to alternative care sites. We would do things before that, before we'd actually start to delay what has oftentimes been really essential non-COVID care.
Our next question comes from
Thank
Jay
you.
Hanselman from WVXU.
Good morning. The question I had about Duke Energy and alternate sites has already been answered, but I did wonder if I could ask Greg a question. Morning. We've heard a lot this morning, I think, that has been a little bit different from previous briefings, where we've heard the word purple on the heat advisory or the health advisory map. You know the data. Are you setting folks up that there's a likelihood that Hamilton County will be purple when that map is released tomorrow afternoon?
So the governor's map, it has 7 indicators, and we have been sitting with 5 of those 7 indicators flagged and of concern. And there are 2 indicators in which we're still not flagged, and I would say we're very close, particularly with hospital admissions, to seeing that indicator shift to being flagged. We continue to make some improvements with volumes within our hospitals associated with overall volumes, and so it's a little bit unsure if we'll go this week, but if we continue on the trend that we are currently on, it's inevitable that we will eventually turn purple here in Hamilton County. I will caution that there is a step before purple, and on the governor's map there's a star that indicates that you've met 6 or more metrics. If that happens, then the following week, if you don't make improvements, that's when you go purple. So at most this week we would end up red with a star if we have another metric go flagged.
Okay, thank you.
Yep.
Can I just, so Greg just gave you some really great information about the trends. Greg's not responsible for these numbers. I mean, he's conveying information that we are seeing in this community. We are all responsible for these numbers, right? I mean, we're the ones that, as he talks about these indicators, he's responding to what's happening. We're the ones that control what's happening, right? So everybody in this community needs to understand what this trend looks like and how close we are to getting into this purple zone, and take action yourselves, because I don't, it almost sounded like Greg that Greg's kind of Greg's not responsible for this stuff. We're responsible for this stuff. So I just wanted to be really clear on that point.
Next question is from Mariel Carbone of WCPO, and it is for Dr. Lofgren.
Hi there. Yeah, just 2 quick things. I mean, for you, Doctor, when you hear, when we started this off, Commissioner Driehaus had reiterated some of the words we heard from the governor, the red tide, shocking. When you hear the governor saying those words, how concerning is that for you when you're looking at the hospital system?
I think the point is that we have done a great job in suppressing the spread of this virus. We've had a couple upticks, a couple hot spots before. We've mobilized resources. We've been able to bring them under control. We know how to really suppress the spread of this virus. This rather rapid uptick in the last 2 weeks is of concern. There's no question. The idea that we are seeing more hospitalizations than we've ever seen in the course of this pandemic has our full attention, and it's just in the wrong direction. And I think the other part that really I react to personally is that we've learned a lot, and we've learned that some very simple things really make a difference. They talked about compliances within our businesses, very simple things about whether or not you create a safe environment where everybody's wearing a mask, people are following the rules. The virus won't spread. You drop your guard, the virus can spread. It really is always in sort of the background, and it's really remarkable on how quickly it can spread. I think the other thing I'd also want to highlight is that from my perspective, and Health Commissioner mentioned this, is that there's one thing about looking at cases, which has a lot of factors involved in it, including testing. But the real evidence of the burden of the disease in the community is those number of people who are so sick that they require hospitalization. And the fact that we've seen this marked uptick in the last 2 weeks really, I think, is purely clear evidence that we're seeing an increased burden of this disease in our community. and that we need to take those actions that are necessary as a community, because that's really what it takes. All of us doing some simple things for each other to make sure that we can keep the virus under control so that we can open up our economy, open up our schools, open up our lives, and change the way in which we do things, but doesn't mean we need to eliminate them.
And just lastly, you know, when we go back to March or April, I know there was the big press conference with all the different heads of the hospital talking about, you know, what it looked like in our area as far as the number of beds and ventilators. And that was really the scare that there wasn't going to be enough of those things. You say we're in a better place with PPE and equipment, but what does it look like? I mean, how many hospital beds do we have, and how many ventilators do we have right now as we're seeing this uptick?
Sure. I don't have those numbers right in front of me. Quite honestly, we follow them in a tracker every day, both at a regional level and at a state level in terms of both hospital beds full, ventilators, ventilated beds, ICU capacity as we look at it. And we have a map that we look at every day about the capacity and availability. One of the things that we're seeing is that we've seen an increase in the use of regular med-surg beds. As Health Commissioner said, we've not seen quite as big an uptick in ICU like we did in the spring. And I think that's in part because we've learned a lot more about how to identify people earlier in the course of the disease. We're intervening with therapies that we didn't have in the spring, such as remdesivir, steroids, passive antibodies, convalescent antibodies. So I do think that it's a different course, but we have keep a very close eye on how many ICU beds, how many ventilators we have, and making sure that we have the capacity. Definitely a concern in April. We have a much greater sense of what our resource availability in our community is now.
Thank you.
Okay, and we have one more question, and it's from John Linden, and this will be the last question.
Okay, so also, I have a question for Dr. Lofgren. I don't mean to interfere. No, but it's you know, you're here, and so I've heard you speak before about the idea that people are being hospitalized, but we've gotten better at making sure that they recover from the virus. And so talk to us, though, about the lasting effects for some individuals. Even though they recover and the disease is not fatal for them, there sometimes are lasting health consequences. So could you just illuminate just a little bit, sorry, John, illuminate just a little bit on that?
Certainly, thank you. You know, again, one of the things I do say frequently is that we've learned a lot about this virus, and there's a lot more to learn about this virus. And you mentioned the issue about the long-term consequences of this infection, which is really, I think, distinctly different than actually the common flu. One of the things that we've come to recognize that a lot of the damage to the body is because of this immune response or inflammatory response that's out of control, that actually causes blood clots, it causes organ damage, it causes long-term effects. And what we're seeing is that even amongst younger people who've recovered from the virus, they actually have lingering symptoms in terms of feeling like they're in the fog or profound fatigue. I was talking to colleagues across the country at other academic health systems, and each one of them are talking about how they're setting up what they're called long hauler clinics to really understand that there are people who actually do have sort of lingering symptoms for a period of time, probably related to this intense inflammatory response that's somewhat unique to this virus that we're still learning a lot about. So it is not only sort of the impact it has in causing death, but there is a small cadre, but a distinct group of individuals that have a hard time recovering.
Thank you. Yeah, we don't know who John's question is for. John,
Yeah,
who's your question for?
For you, Denise, and and just in case no one's ever said this to you, appreciate all of you for staying on top of this and also for being so available to update the public, because this is as important as it gets. And hearing Greg say 5 of the 7 indicators that we're meeting to come close to purple, I can't help but wonder if you're putting too much reliance on asking people to do the right thing and follow the advice of medical and health experts, and not enough emphasis on establishing some hard and fast rules at this point as we head into the colder weather and people start to move indoors. So do you see the need to, any of you, ask the state about requesting more restrictive action, because we talk to people all the time who say, look, we get together all the time and no one's got sick. So that's kind of what you're combating.
I understand the question. We do have hard and fast rules. And remember, the county doesn't have the authority to shut down bars or restaurants and that kind of thing. So the authority of the county is limited. However, the health commissioner is a different story. And so there are rules about wearing masks in retail establishments. There are rules about gatherings and how many people can be in gatherings. I think the challenge is that the only way the health department responds to something like that is when a complaint is lodged about something that's happening that is against the rules. And I'm actually going to kick it to Greg because he knows more about this than I do. But John, it's not as if we don't have restrictions in this community. We do. It's a matter of people following the advice. And that's been the challenge. And I don't disagree with you. I mean, it's frustrating when we know that there are people out in this community. I just heard a story last night about a group of young parents, young kids, socializing within their neighborhood. They get together. They feel, because they're young, they feel fairly confident they're not going to die from the disease and probably won't be hospitalized. But as Dr. Lofgren just said, some young people have lasting negative health consequences because of this virus. So there's that. Beyond that, these young people and their kids could potentially spread this disease to people that are vulnerable. So I think the plea is, even if, I frankly feel like I'm in fairly good shape. I'm not 60 quite yet. If I got this virus, would I die from this virus? I feel fairly confident, but I'm wearing a mask every day. I mean, I'm not necessarily doing it for me. I'm doing it for everybody else, right? I mean, I don't know if I'd be asymptomatic if I had it, but we all need to do our part and protect one another. It's not about me. It's about everybody that I come in contact with. And so the plea is for folks that feel very cavalier about this, that think through that, not only in the impact to you and your family, but to others around you. And that's kind of, I think, the plea from all of us. But let me have Greg talk very quickly about the health board's response to folks that are violating the rules.
So just real high level, the majority of our businesses are just doing a phenomenal job, and I really commend their work. My team does respond to every complaint that we get. I mentioned earlier in this briefing that we see between 13 and 15 complaints on average per day over the last several weeks. When we get a complaint and it's reoccurring, we do issue notices of violation, and oftentimes that inspires businesses to come into compliance. I routinely share that if we as individuals make the decision not to patronize those businesses and to make sure that they know that we're leaving, we will make an impact in those locations. I think the other thing that I shared last week really holds true, and that because our businesses are doing such a good job, when you go to a grocery, you see almost everyone wearing a mask. When you go to most stores, that holds true as well. But when you're looking at your Facebook feed or you're at a sporting event for kids, I don't think people are taking it quite as seriously. And that's where I think we can make the biggest impact as individuals. We did it last time when we sounded the alarms back in July. We sounded the alarms and we saw cases drop. We started wearing masks as was required here in Ohio on July 8th, and things came back to a good level. We can do that again, and I'm asking each of us to take that personal responsibility.
All right. Well, we've gone a little longer than usual, but I really think it's been an important conversation. Again, thanks to Commissioner Kesterman for being here as always, and Dr. Lofgren for being with us. It's really been a really helpful conversation. So thank you all for joining. We've given Jay a bit of a workout today, so we're going to end now. We'll see you next week.